Welcome back, everyone, to the deep dive. Today is March 18th, 2025. And as always, it's quite a lot to keep up with in healthcare these days, right?
Absolutely.
Yeah. But that's why we're here. We're doing a deep dive today into all the news that matters in healthcare. And we're pulling from, a variety of sources to give you the full picture.
That's right. We've got healthcare policy stuff,
Yeah.
business news, technology advancements, and even global health updates. So we're really trying to cover it all for you.
Exactly. So let's get right into it. Okay, first up in healthcare policy, we have a federal judge who has temporarily reversed those HHS layoffs that we were talking about.
Right.
Yeah. And the judge is concerned, it seems, more about the way the terminations were done during the Trump administration than like the actual policy itself.
Interesting. So for those of you keeping score at home,
Hmm.
this really highlights that even when a political party changes, the way things are done still matters. And it can really impact, how these agendas are carried out.
Exactly. Okay, next we have the ongoing debate about Medicare telehealth flexibilities. Now remember, Congress has extended them for another 6 months.
Right.
So that means you can continue to see your doctor virtually, but the bigger question of permanent coverage is still up in the air.
Yeah, this really demonstrates that tension in healthcare between needing to be flexible in a crisis
Yeah.
and making sure we have a stable long-term plan.
Yeah,
I mean, these extensions are great for now, but what about the future, right?
absolutely. Okay, in other Medicare news, Dr. Oz had his confirmation hearing to lead CMS.
Wow.
Yeah. He said he's going to really scrutinize those Medicare Advantage plans for upcoding and wants Medicare to cover new medical devices quicker.
So that upcoding thing,
Yeah.
a lot of people might not know what that means. It basically means billing for a more complex and costly service than what was actually provided,
Right.
which could really drive up costs, right?
Exactly.
As for the devices, that's interesting too, because it could mean faster access to innovative technologies for Medicare patients. But how do we balance that with, proper evaluation and safety?
Good point. Now, switching gears a bit, HHS has filed a brief in the 340B rebate model case.
Okay.
They want a federal judge to dismiss lawsuits from pharmaceutical companies who are challenging the agency's stance.
This 340B program is so important for hospitals that serve low-income populations. It allows them to buy drugs at a discount.
Right.
So this case is really about drug pricing and making sure vulnerable patients can get the medications they need.
Absolutely. Okay, now this next one is big. The Trump administration has actually halted funding for the National Diabetes Prevention Program, the NDPP.
Oh.
Yeah. And this might be connected to the cancellation of federal grants to Columbia University. This program is based on a 30-year study, and the American Diabetes Association is not happy about it.
What's crazy is we're watching When Calls the Heart, and they just showed how insulin was first used, and it's like this big, exciting moment.
Right.
And then in real life, we're cutting funding for diabetes research.
Yeah.
It's like we're going backwards.
It's almost ironic, isn't it? Okay, on a completely different note, President Trump has issued an executive order to stop gender-affirming medical care for transgender prisoners and says trans women should be housed in female prisons.
There are some serious concerns about this, like denying necessary medical care to these prisoners and putting them in potentially dangerous situations.
Yeah, it's a sensitive issue for sure. Okay, in more positive news, Congress passed a full-year continuing resolution bill, which means global health funding will stay at the same level as last year.
That's good news. In a world where funding can be so unpredictable, at least the organizations working on those important health issues globally can have some certainty.
Absolutely. Okay, now let's jump into some industry and business news. There's a definite trend towards consolidation in radiation oncology practices in the U.S.
Okay.
Large practices are on the rise, while solo practices are fading away.
This could mean fewer options for patients, especially in rural areas. It's a trade-off, though.
Yeah.
Bigger practices might have better tech, but what about personalized care?
That's a good point. Okay, next, hospital margins seem to be holding steady at the start of 2025. But there's a catch.
There's always a catch, right?
Right. It's because of higher service volumes and also, you guessed it, increased expenses.
So basically, the pressure on healthcare costs is still there, and it's likely going to keep affecting how much we all pay for care and insurance.
Oh, definitely. Okay, in philanthropy news, the University of Utah got a huge gift, $75 million to build their first off-campus hospital.
Wow, that's a game changer. Donations like that can really help expand services, see more patients, and do more research.
For sure. Okay, now this is kind of fun. A health system in Louisiana is actually changing its name back to what it used to be.
Interesting. What is it?
It's Our Lady of the Lake St. Elizabeth. They're expanding their services, so they wanted to go back to their roots.
I see. It's all about branding, right?
Mhm.
And connecting with the community. It might mean more services for patients, too, under a name they trust.
That makes sense. Okay. Remember that controversial Indiana hospital merger we talked about?
Yeah. What's happening with that?
Well, the FTC is still saying no.
Really?
Yeah. Even though Terre Haute Regional might have to close without the merger, the FTC is worried about competition.
So it's about balancing the needs of the hospitals with making sure patients have choices and fair prices.
Exactly. Okay. In pharma news, Merck is laying off 163 employees and closing its plant in Pennsylvania.
That's rough, especially for those employees and the local economy.
Yeah.
It just goes to show how much the pharmaceutical industry is changing all the time.
Right. Okay. Fosun Pharma has agreed to sell its entire stake in United Family Healthcare. This is a big deal in the world of healthcare investments.
I wonder what that means for United Family Healthcare. Might be changes in ownership and services coming down the line.
Maybe. Okay, next, Pandion acquired Black Maple Group. They're a purchasing organization for independent physician practices.
Interesting. So this could give those smaller practices more bargaining power and maybe even better prices on supplies.
Possibly. And last but not least, a new study shows that the number of caregivers in the U.S. has gone way up, from 18 million in 2011 to 24 million in 2022.
Wow.
Yeah. This just goes to show how important it is to have support systems in place as our population gets older.
Absolutely. Okay, so let's dive into the world of tech now. Google just launched an AI tool called What People Suggest.
Interesting.
It basically gathers information from online discussions about similar health conditions. It helps patients compare their experiences.
Oh, that's cool. So it's like getting real-world perspectives from other people who are going through the same thing.
Exactly.
Okay. What else is going on in AI?
Well, Mistral AI has a new open-source AI model,
Yeah.
Mistral Small 3.1. It's supposed to be better than GPT-4 Mini, but with fewer parameters.
I wonder what that means for healthcare.
Well, it could mean even more sophisticated tools for diagnosing and treating patients. And who knows, maybe even less paperwork for doctors.
Okay, that would be great. Now there's a report that OpenAI is testing something called ChatGPT connectors to link ChatGPT with things like Slack and Google Drive.
So they want to bring AI into more of our work tools.
Yeah, seems like it.
And if it can help streamline things in healthcare, that would be a huge win.
Right. Speaking of ChatGPT, it looks like 39% of U.S. adults have already used these large language models for health information.
Wow, that's a lot. I mean, it's great that people are using these tools, but we really need to make sure everyone knows how to evaluate the information they find. Not everything online is accurate.
Definitely. Okay, this next one is interesting. Turn AI has developed an AI-based GPS system that doesn't need satellites.
No satellites. How does it even work?
I don't know the details, but imagine how helpful that could be for like emergency services or healthcare workers in remote areas.
Absolutely. It could be life-saving in those situations where traditional GPS might not work.
Definitely. Okay, in biotech news, Valo Health and Inference are teaming up to use AI and patient data to speed up drug development.
That's exciting. If we can harness the power of AI to analyze all that data, it could mean new treatments much faster.
For sure. Okay, Duke University Health System is rolling out something called a Bridge.
What's that?
It's an ambient AI listening tool for doctors. Apparently, one of the leaders at Duke thinks it's the most impactful technology he's seen in 30 years.
Wow, that's a bold statement.
Yeah. It's supposed to automatically document patient encounters so doctors can spend more time focused on patients.
That sounds amazing. It could really change the whole doctor-patient dynamic.
Right. Okay. Honeywell has some new software called Swift Decoder. It's all about improving barcode scanning in healthcare.
Okay, why is that a big deal?
It's all about efficiency. The faster and more accurately they can scan barcodes, the fewer errors and the smoother everything runs.
So it's not just about technology, but about how it's actually used in practice.
Exactly. Now this is cool. MIT researchers have developed a way to use microparticles to fortify foods with vitamin A.
Wow. That could be huge for combating vitamin A deficiency around the world,
Yeah.
especially in countries where getting enough nutrients is a challenge.
Absolutely. And last but not least, in tech news, MIT and Novo Nordisk have created a capsule that can deliver drugs directly to the GI tract.
No needles?
Nope, just swallow the capsule.
That's good.
It could be a game changer for people who hate injections.
Sign me up.
Right. Okay, let's move on to healthcare delivery and access. The annual NHS staff survey in the UK shows less burnout, which is great.
That's fantastic news.
Yeah. But there are still concerns about harassment and bullying.
That's a shame. A
Yeah.
healthy work environment is so important, not just for the staff, but for the quality of patient care, too.
Absolutely. Now, the RCGP in the UK is warning about more work for GPs because of new guidelines about BMI checks.
I see. So it's a good idea in theory, but it could mean longer wait times for patients if doctors are overloaded.
Right. Okay, in Australia, Queensland is trying to give frontline healthcare workers a bigger voice. They're introducing a bill to put clinicians on hospital and health boards.
That's a great idea. They're the ones on the front lines. They know what's working and what's not.
Exactly. And South Australia is launching its first fully rural medical degree program at Flinders University.
Oh, wow. That's really tackling the doctor shortage head on. If students train in rural areas, they're more likely to stay there and practice.
For sure. Okay, in the U.S., Intermountain Health is making it easier to get common medications and services without seeing a doctor.
On-demand healthcare, that's the future. As long as it's safe and appropriate, it can save everyone a lot of time and hassle.
Definitely. Okay, and there are a bunch of new facilities opening up. A mental health clinic in Arizona, an infusion suite in Indiana, and a new medical center in California.
Wow, healthcare is booming in those areas.
Yeah. But plus, Adventist Health is redesigning a clinic to be more accessible, and Stanford Health is partnering with ULA to offer midwifery-led maternity care.
So it sounds like there's a real focus on expanding access to care and making sure different needs are met.
Absolutely. But not all the news is positive. KLAS research is warning about physician burnout from all the electronic messages they get from patients.
It's a double-edged sword, isn't it? We want easy communication, but it can be overwhelming for doctors.
Yeah. And if doctors are burned out, it affects the quality of care.
Absolutely.
Okay, last one in this section. MedPAC is recommending that Congress tie physician pay to inflation starting in 2026.
That's a tricky one. Physicians deserve to be paid fairly, but it all comes down to healthcare costs in the end.
For sure. Okay, let's finish up with some research and innovation. Mayo Clinic researchers have found some proteins linked to immunotherapy resistance in metastatic colorectal cancer.
Now, that could be a major breakthrough. If they can figure out why immunotherapy doesn't work for everyone, they can start to develop better treatments.
Exactly. Okay, and there's a concerning report that scientists are being told by the NIH to remove references to mRNA from their grant applications.
If that's true, it's really worrying. mRNA technology has so much potential for vaccines and other therapies. We can't just abandon it. It makes you think about what research will be prioritized in the future.
It does. Okay, last but not least, there's a big digital health event coming up in the UK called Digital Health Rewired 2025.
They're going to be talking about the restructuring of NHS England. That's going to be interesting to follow.
For sure. Okay, we have a few more miscellaneous news items to cover. First, the ongoing issue of tariffs. Medical device manufacturers are worried about how they'll impact costs, and President Trump's stance on trade isn't helping.
Yeah, tariffs can really drive up prices for everyone.
Okay, here's a positive one. Health Ommeter Professional Scales is launching a new wheelchair scale that meets ADA standards.
That's great to see. Accessibility in healthcare is so important.
Okay, and OSF Healthcare has put out some helpful information explaining the difference between flu A and flu B.
That's always good to know during flu season.
Right. Okay, here's a reminder about a recall of Clorox Pine Sol cleaning supplies from back in 2022. Just goes to show how important it is to be vigilant about contamination risks in hospitals.
Absolutely. Infection control is crucial for patient safety.
Okay, and P3 Care Analysis is reminding everyone about the importance of accurate medical billing and coding. They're also highlighting some upcoming regulatory changes in 2025.
So behind-the-scenes stuff, but it really affects how the whole healthcare system runs.
Right. Okay, Mayo Clinic has settled that dispute with the Minnesota Attorney General about their charity care policies.
It's good that they reached a settlement. Charity care is so important for people who can't afford medical care.
Hey, there's a disturbing trend of more cancer being diagnosed in young adults.
Yeah, that's really concerning. We need more research to figure out what's causing it and how to prevent it.
Okay, and just a reminder that cyber attacks are a real threat to healthcare. There's a ransomware developer who allegedly targeted hospitals who has been extradited to the U.S.
It's scary to think that someone could just disrupt patient care and steal sensitive information like that.
It is. Okay, and it looks like the debate over kratom regulation is still happening at the state level. No action from the federal government yet.
So it's a confusing patchwork of laws across the country. That makes it hard for consumers to know what's safe and legal.
Okay, and finally, KFF has been busy fact-checking some misinformation about Medicaid use by Latinos. They also have some useful resources like global health budget summaries and a global COVID-19 tracker.
It's great that they're providing accurate information and keeping track of global health trends.
For sure. And that's it for today's deep dive.
Wow, we covered a lot.
We did. As always, we encourage you to dig deeper into any of these stories that caught your attention.
And here's something to think about. With all these changes happening in healthcare, how do you see them impacting your own experiences in the future?
That's a great question. Thanks for listening, everyone, and we'll see you next time for another deep dive into the world of healthcare.